Hello,
Hello.
I'm Isabelle from France.
Hello, Isabel.
Bonjour, Isabel.
Hello.
Hello.
Hi, Gabriela.
Hello, Kathy.
So just before we start, for those who are joining, please select your language channel of preference. At the bottom of the screen, you will see the icon interpretation, and you will find that simultaneous translation is available into
Recording in progress.
French, German, Italian, Spanish, English, Portuguese. Just let us know if you have any issue with finding the interpretation channels. Can we make a test in the multiple channels? I'm going to speak in English, so those who are in different language channels, please put your thumbs up if you can hear well in your preferred language. Is it working? Nicole, Salvo?
Yes.
Io ti sento bene, però non ho capito
Ascolto
come
bene.
scegliere la lingua.
I don't know how to select the language.
So you can go to the
Interpretation, sì.
and then
Io,
select your channel, Italian, for example.
però non mi fa entrare.
It doesn't let me in on the channel. It doesn't allow me to select.
Can you try?
Non riesco a vedere. I can see my channel for choose my language.
You should select your channel and it should work. And Patricia, I don't know if can you just double check?
Salvatore,
Sì?
Salvatore, ciao, sono Cristina.
Ciao
Ben
Cristina.
arrivato.
Ciao.
Tu non riesci a vedere il globo con scritto
Sì, il globo
interpretation?
lo vedo anche che è segnato in rosso, però non ho capito come riuscire a scegliere il canale della lingua.
In basso, nel tuo schermo, dovresti
Sì.
avere diverse icone. C'è una prima
Sì.
icona che è il microfono, la seconda icona è la videocamera,
Sì, poi c'è
poi hai
partecipanti,
partecipanti, chat,
chat.
reazioni,
Mhm.
qualcos'altro e poi dovrebbe esserci il globo. Non lo vedi in basso? Se non lo vedi, ci sono i
C'è-
3 puntini.
Sì, 3 puntini, more.
Clicca sui 3 puntini.
Sì.
Vedi il globo adesso?
Il globo lo vedo, è cerchiato in rosso, però come faccio a
È
scegliere?
cerchiato in rosso nella slide.
Sì.
Invece in basso nel tuo schermo lo devi trovare.
Ho capito. In basso al mio schermo io non lo trovo.
Se muovi il
Click in the-
mouse,
Click in the icon and you will see the languages.
Aspetta un attimo, Scusatemi. Ora non riesco a... Mi vedete?
sì,
Allora, io purtroppo non riesco a vedere il globo nel mio... In basso non riesco a vedere.
vedi
anche
però
se
i puntini?
altro, interpretare... Oh, ci sono.
Esatto,
Ok,
in alto, perfetto.
Ho scelto. Va bene così? Ce
So
l'avete
thank you very much. I think it's working now. I received confirmation
Scusatemi.
from most of the participants. Just before we start, the intention of today's meeting is to foster best practice sharing and peer-to-peer collaboration among the patient community in Europe. So today's meeting is not a promotional meeting or education program. It's just a session to foster collaboration and community building. So for those who are joining us for the first time, my name is Cristian Perez. I am I'm responsible for patient relations in Europe at Blueprint Medicines. It's a real pleasure to having you all here today with us. We kindly invite you to turn your video on if you feel comfortable. During the session, we're going to have different moments for interactions. So if you have a comment to share, an experience to share, or a question, just feel free to raise your hand using the reactions icon at the bottom, and we'll assign you the slot to speak. Or if you prefer, just put your comment directly in the chat function. You can write in your own local language, then we will find a way to translate your comments into multiple languages. So if you are experiencing any technical issue, just feel free to reach out to Jenna Taylor through the Zoom chat or directly to her email that you see her email there below. So having said that, again, welcome to all of you to our first SME exchange session. As you already know, today's session is focused on mental health and how to address the invisible burden of systemic mastocytosis. Some of you may remember that earlier this year, we shared with you a survey to collect your feedback on what would be the topics you would like to cover along the year during these exchange sessions. And the three most voted topics you selected were mental health as a first topic of interest for the community. The second topic was about how to manage volunteers, and we will provide you additional details later today. And the third topic was about how to develop high quality educational materials for the patient community. So we are starting today with this first session focused on mental health, and we are having Matt Johnson from Eurordis joining as our keynote speaker. And we are really excited to have such a diverse country representation. You will see there a lot of flags, many different flags representing countries from Europe. So thanks for all of those who are joining us for the first time. It's a pleasure having you all here today. So the meeting objective for today is our primary just to understand why mental health is important for those who are living with systemic mastocytosis. We also want to invite you to share your experiences from a country perspective on what are the things that you are doing to support your local community from a mental health perspective. We also want to discuss with you together what can be done to improve the supports that patients are receiving and caregivers are receiving across different countries. And then we also finally want to end up the meeting identifying a couple of actions that can be developed together to overcome those challenges. I think, Clarice, your hand is up. Do you have any comment?
Oui, bonjour. Du
Bonjour.
coup, est-ce qu'on répond tout
Hello,
de suite?
everyone. So what's the expectation? Do we have to answer now? Do you want us to answer to these questions, or should we wait for the presentation?
The question you just addressed it?
We should wait. We will address these questions along the session.
Oh,
So the agenda for
okay.
today.
Thank you.
Thank you. So this is the agenda for today. As we shared, we're having Matt he will share with us his perspective and what Eurodis is doing on mental health. Then we're going to have two slots for breakouts and for discussions to cover those two topics: the current challenges facing that the community is facing, and also what can be done to support the mental health from a community perspective. And then we're going to close and wrap up, and we're going to share with you next steps. So with that, I would like to invite Georg to share some welcome and opening remarks on behalf of Blueprint Medicine.
Well, thanks a lot, Christian. And I will start off by saying good afternoon, everyone. Good morning for those in the United States. Pleasure to be here with you today. And I think we're starting this off nicely. If I counted correctly, there were 13 flags on the previous slide. So 13 countries represented here today. This is super cool. And actually, we got already a little bit of an Italian and a French language lesson, which is really nice to kick off this international setting here for the first SM exchange that we're celebrating today. So, who am I? My name is Georg Pimmelmeier. I'm the head of international for Blueprint Medicines. Very honored to speak with you today about a little bit the mission, the journey that we're on, and specifically the commitment that we do have for the community with systemic mastocytosis, meaning you. So just very briefly, Christian asked me to give a brief introduction of what we do, where we are at Blueprint Medicines. And I wouldn't want to kick this off with a vision that we have for international, and I hope I don't speak too fast. I will slow myself down for the translators. And that is a very simple vision that we came up with the international team here. We are roughly 90 people now in different European markets working for Blueprint Medicines. And the vision is to become the partner in systemic mastocytosis. So that's the one piece that keeps us up at night. That's the purpose that brings us out of bed in the morning. That is what we're here for. And that is where we hope to really engage and learn and discuss with you a lot today and in upcoming sessions for the SM exchanges in the future. At Blueprint Medicines, we are guided by our core values. And the first core value actually is patients first. So I think that speaks a lot to becoming this partner in systemic mastocytosis, where we recognize we're just at the very start of it. And together we will create that journey and hopefully make a huge difference for our patients and caregivers in the future. The second one of our core values is trust. And we have optimism, thoughtfulness, and urgency. While the later two, thoughtfulness and urgency, not always go hand in hand. They're a little bit contrasty once in a while. But this is what guides us. This is every decision we make and every action we take are guided by our core values. Just very briefly on the history of Blueprint Medicines, probably most of you had some contact with Blueprint Medicines in the past or came across us on the website or wherever, but it's a company that is new, meaning we were founded in 2011, means that we are 13 years old. We are entering the teenager phase. And that is what we are as a company. We are a startup, scale-up company where we are today. We are really just getting started in the sense of what we want to do and how we craft the vision of bringing precision therapies to target the genetic drivers of different diseases. And that's also our scientific foundation, where we're really leveraging the deep knowledge that we have in the understanding of the molecular underpinnings of these diverse diseases, and here specifically systemic mastocytosis, to then develop therapies that are targeted to treat the underlying cause of the disease, the mutation, so to say. So over the last years, we did have a couple of milestones. The first 7 years were all about research and development and just trying to understand what it means to then help you and community to bring those targeted therapies into the markets. This is what our main stake is today. We did already launch 2 products in the United States and with avapritinib, and this is not going to be a sales show. I'm going to be very precise on this, but that's what we do. We developed avapritinib for the treatment of systemic mastocytosis, launched already 3 years back with a European approval in the advanced SM setting. And just at the end of the last year, we got the indication for indolent systemic mastocytosis with Germany out of the blocks and many, hopefully more countries coming very, very soon. And that's what we're working on to bring some help for the community with systemic mastocytosis. So the impact that is clear, that is for the first time a groundbreaking therapy specifically designed for the genetic driver, which is KIT D816V. So that is great. That is just the start, though. And I think all of us together, we have an opportunity with a very much focused on the patient centricity approach to make that difference. So our aim is to work obviously closely with investigators, with the medical community, give them more opportunities to better understand your journeys, but then really listen and sit down with you, the patient advocacy groups and the representatives of those, to really make sure that the therapies that we are developing are fulfilling the need that you and your families or your peers and friends do have. So that's where we are in the beginning of this journey with Blueprint Medicines. What else? We are obviously trying to bring the opportunities not only for Blueprint Medicines, but also with other assets that are coming to ever more patients and physicians worldwide. That said, avapritinib is out, but we're already developing a second generation inhibitor that will hopefully even serve more patients. And I'm not shy away from talking about Cogent, which is also a company really heavily focused and invested in supporting the community with systemic mastocytosis, and others more to come. So that's I think that's where I want to be getting to my ending here of the day. Like, very thankful where we are today. Very thankful for getting the chance to sit down with you and listen in what we have to discuss and how we can learn and support you better in the future. The engagement is with you. It's all about you sharing your insights, sharing and collaboratively communicating about what's going well in one market, what are your experiences from other markets, how can a company like Cogent or like us or any other company actually support the SME community. So that's what we're here for. And I'm truly optimistic for the future for patients and caregivers in systemic mastocytosis. Personally, I do come from an area where I worked before in cystic fibrosis, and I had the opportunity to accompany a company which is called Vertex to really make a difference, and was there from the beginning to then also see how, like in the beginning, was only 5% of the patients that could get a benefit of any of those targeted therapies. Now this company is offering their opportunities to 95% of the patients with cystic fibrosis. So for me, it's great to see what we all together can achieve. And this is why I'm super hyper optimistic for the future, for also what the patient advocacy groups and the patients and families you represent can then really drive. So thank you once again for the opportunity to be with you today, to speak with you today. I'm really looking forward for the continued partnership that we are hopefully starting really today, and the impactful work we will hopefully also accomplish together. And with that, I'm handing it back to Christian. And obviously, we're always happy to get questions either online or which way you want. You can also follow up with us later on. Thanks a lot.
Thank you very much, Georg. So without further ado, I would like to invite Matt to introduce us into the mental health topic from his perspective and Georg's perspective as well.
Hi, everyone. Hopefully you can hear me. Thank you very much for inviting me to come today to talk to you about mental health and how important that is for our community. I work with Eurodis, which is an umbrella advocacy organisation. We have over 1,000 members from 74 countries. Over the last 10 years of working with Eurodis, I've heard repeatedly that mental health is a key challenge for our community, but for a long time it's been overshadowed and neglected. But now we're taking action to address that. I think I'm not quite at the right bit of my slide. Yeah. So to start us off, I just wanted to cover what mental health is, and I love this definition. So I'm going to read it out, and hopefully that's helpful for the translators as well. So I love this definition because it's set out by the World Health Organization. Mental health is defined as a state of well-being that enables people to cope with life's stresses, realizing their abilities, to learn well, to work well, and to contribute to their community. It's an integral component of our health and well-being that underpins our individual and collective abilities to make decisions, build relationships, and shape the world we live in. It's crucially to our personal and community and social economic development. So I think we saw in the COVID pandemic how much health is it underpins our ability to have an effective society and economy, and mental health is a core component of that. But when we think about mental health, actually there's a range of factors which influences whether we have good mental health or whether we experience some challenges in our day-to-day lives. There's a set of risk factors and there's some protection factors. So the risk factors, to give you an example of, could be that you live with stigma or prejudice or bullying, that social isolation can be a risk factor for poor mental health. Experiencing poor physical health is also a risk factor. And living with uncertainty can increase stress and our anxiety. Financial distress and our ability to work also impacts on that. So again, in the COVID pandemic, we saw an environmental issue which going on, which caused us to have to stay at home. And that was one of our risk factors which we experienced. But there's also some protection factors, things that we can do to optimize our mental health and well-being. Not surprisingly, good physical health is something which is a protection factor for our mental health. Our ability to be connected into a community is also there, whether that's a community, your local community, or being connected into a community of people living with a similar rare condition. Access to information and support is also one, and being able to have the opportunities to pursue your interests. So these are called psychosocial factors which impact our mental health and well-being. It's not just simply something which is comes from us. We're sensitive to the world we live in. So why is mental health so important to our community? I mentioned before that for a long time now, mental health has been an unseen and neglected need. I always think about rare conditions, our community, that we live in one of two worlds. We're either on a day-to-day basis firefighting, crisis managing, dealing with an emergency, or we're alone. And it's when we're alone that sense of isolation, the sense of that the psychological impact of the situation and the experiences we're having living with the rare condition really come home and hit us hard. So it's time now that we're not just alone, but we connect together to support each other. And I think our advocacy over the last 20 years or 25 years has really been focused on addressing those, medical complexity aspects like finding a diagnosis, securing a treatment or access to treatment, or even pushing research to find a treatment and cure. But I think we're a community now which is more mature and grown up. So I think it's fine now to put mental health at the forefront and take action to say our mental health matters and to really take action to improve that. I always think about mental health and rare diseases, the impact of rare conditions on mental health on two levels. On an individual level, there's some rare conditions where mental health is a primary characteristic or a comorbidity of that condition. A lot of rare and complex epilepsies, neurofibromatosis type 1 are some examples. But at a population level, everyone who goes through that rare disease or rare condition pathway experiences the psychological impact of that pathway, which I'll come to in a minute. Our community has raised that now is a time to look beyond the physiological symptoms of a rare condition and take action to address the psychological impact we experience. I talked about, as a population, everyone with a rare condition, whether it's an individual or their family, experiences some stresses associated with going through that journey. And I'll give a summary now. The first area is around, with the rare disease pathway, is that diagnostic odyssey. However long or short that is, it's quite a traumatic process. It's quite a lengthy process for some. It's averaged about 5 years for many. And that journey is a history of misdiagnosis. It's a history of speaking to healthcare professionals who don't listen, who question, is there something really wrong? Because the symptoms might not be clear to them, those red flags aren't visible. And at the point of diagnosis, how a diagnosis can be given, even if it's a misdiagnosis, can really either empower an individual to take on that challenge that diagnosis brings, that future life of living with that condition. But when it's done badly, giving a diagnosis with poor communication information, that can destroy lives. It can erode the trust we have of our healthcare providers, our clinicians, not just at that point, but for the rest of the journey and the rest of the time we engage with healthcare services. As a community, we live with multiple uncertainties. In some respects, you could call them chronic uncertainties. About the future, the prognosis, it's unclear. Living with that increases our anxiety. And I'm sure many of you have experienced this. But when you see a healthcare a clinician at a hospital, whether it's or in primary care, and there's a low level of disease awareness of the condition, and they say, sorry, what condition's that? No, I don't know that. Or in the community, when you speak to people, friends, neighbours, or even family members, that you explain about the rare condition and they don't understand, that can lead to you feeling isolated, that your needs aren't understood and recognised, and it can build up with frustration. When cancer affects a lot of people and touches on lots of family lives, including my own, and when someone gets given a diagnosis of cancer, everyone goes, oh yes, okay. And they understand it, they lean in and give support. When you give a diagnosis of a rare condition like neurofibromatosis, they go, what? No. And they lean out, they don't understand. I think that's a really difficult part of the rare disease journey. We have a set of these needs associated with rare conditions are quite complex. So there's a high burden we have with managing and coordinating our care. There's normally a lack of coordination. And the increased monitoring and treatment can impact on it being a very traumatic process. And all this adds up to placing strain and stresses on our family lives and our relationships. Specifically around the diagnoses, this impacts the whole family, not just the individual. Because a lot of conditions can be genetic as well, so there is that implication as well. For parents of children with an undiagnosed condition, we've seen that a third of them meet a clinical criteria for being mild or moderately depressed or anxiety. That's really quite high. And we know that there's a lack of support, psychosocial support, through that diagnosis process. And when you have that support in place, actually we've seen that reduces time to diagnosis by over a year. Just to give some figures on the impact of rare conditions on mental health, people in the community are 3 times more likely to be unhappy or depressed than the general population. Another study has highlighted that it's over 90% of people living with a rare disease feel worried, anxious and stressed or depressed, and 19% have suicidal thoughts. That's a significant, scary number, an uncomfortable number for us all. We know that 54% of people with a rare condition declared that the condition has caused or amplified social isolation from their friends and family. That 7 out of 10 people have had to reduce or stop their professional activities or work. And that whilst we're quite happy overall, the feedback is that's quite broad, but it's the case that by our physical healthcare we receive in an expert centre when we find one. Up to 85% of people said that their psychological and emotional needs were never supported by that medical team. So what solutions have we got? Eurodis have just launched the creation of a mentally healthy toolkit. We want to draw on good practice from all the people in the rare disease community to identify good practice and approaches which can be scaled up and applied to your community. So we're working on this now. It was launched last month. We should aim to get it done at the end of this year. And these are tools and resources which your community can use. Oh, it's not responding. Okay. There's a very good paper you can see up here, which the reference is at the bottom, which also has done some work in giving some good recommendations on how to support diagnoses, and some of those things are listed here. I won't go into detail around that, but I'll share with Kathy and Christian the publication. These are clear recommendations which your healthcare services can implement, which won't cost anything, so which will improve immeasurably the situation around how to give a diagnosis. What we're also doing at Eurodis, and we've just published a position paper on this, which is built on there was a UN General Assembly resolution on rare diseases, which was published in 2021. In this resolution, it urged member states to develop psychosocial care programs specifically for people with a rare condition. I only know one country which has that in place, and that's Luxembourg at the moment. So the position paper has outlined really what does psychosocial care look like for people with a rare condition, and we try to then promote that so we can get greater visibility of mental health in rare disease national plans. So when Germany updates its national plan, we want to see mental health needs mentioned there, and we want to see a commitment by the German government to implement psychosocial care programs for people with a rare condition. And this position paper outlines all that. I can share the link with you as well. I said that I'd mention about, or I'd explain a bit of our advocacy we've been doing on mental health. But just to put the context in, the General Assembly resolution I've just talked about highlights the importance of addressing mental health needs of people with a rare condition. The World Health Organization, as we came out of the COVID pandemic, highlighted people with an existing condition, chronic and rare conditions, were one of the main groups living in a vulnerable situation who were disproportionately affected by the lockdown and the pandemic. And this all this has set the stage now in the European Union for mental health to be raised up as one of the European Union's top public health priorities. And we had last year a communication published by the Commission. It's a political document which shows that this public health need will be addressed in Europe. So our work in Europe really will be supported by the European Union. So Eurodis have been trying to advocate on making sure that people with an existing health condition, specifically those with a rare condition, are visible in the mental health world and space and policy. That we're seen as a community and being included. That if policies or strategies by the European Union don't specifically mention our community, they are at risk of further marginalizing and excluding us, who are some of the most vulnerable in society. Another advocacy topic we're pushing is living with a rare condition. You live at the interface, at the point of lots of different situations, which increases your risks of poor mental health. For example, living with stigma or discrimination, living with a visible, invisible disability, being affected, children being affected or at risk of cancer. So all those situations add up and makes our situation more, there's an accumulation of risks which we need to address. And so policies need to see us to take action. So increased visibility, inclusion. This is my last slide. So the mental health work which we're doing, so we're not just, Eurodis are not solely focusing on trying to get visibility of rare conditions in policy at the EU level and nationally, but we're also, as a community, stepping forward and taking action too. Because I think we have a huge amount of experience in our community. We can learn from each other. You all here can learn from each other. And I think that's why I've joined today's SME exchange, and it's a real opportunity. So what we're doing as Eurodis, we've set up something called a partnership network. And this partnership network is aimed at uniting and empowering our community to take action, for us to be seen, to learn from each other and support each other, and really put at the centre our mental health and well-being, and say this is important, we need to take action. We have over 130 people join that already. I was expecting 40, so I was a bit surprised. And there's about 50 clinicians, researchers and psychologists, and the rest of people from our community are leaders. We're doing a survey, it's called Rare Barometer. We have over 20,000 people signed up. This survey will be launched at the end of this year, and it will look at understanding the impact of rare condition on mental health of our community. What's great about this survey is in multiple languages, I think more than 15. So it'd be in German, Italian, Spanish, etc. And we'll be, if your community or any community contributes to this survey, we'll be able to get the results for your condition, and we'll be able to get it based on a European perspective, but also a national perspective. I think this is a real opportunity to support your advocacy. Raising awareness around policy, and we're also looking at building the evidence base as well around this. So I'm going to stop there. Hopefully I'm on time, if not a bit earlier, I hope.
Thank you very much, Matt, for sharing the slides. Just a brief comment. We will share with you a meeting report following our session today, and in this report you will see all the links to all these materials that Matt already shared, and we also provide Eurodis contact for you in case you want to reach out or you want to connect with Eurodis to further collaborate with the rare disease community. So I think we have a very tight agenda, but we're a bit delayed. But I think we have a couple of minutes for 1-2 questions from the participant. So if there's anybody who would like to ask something to Matt or share some ideas, just feel free to open up the mic and just speak. Again, you can speak in your local language. You don't need to speak in English. As translation is available, you can interact in your local language without any problem.
Matt, this is Fatima. Thank you so much for the presentation. Insightful. There's much work to be done to support the community for sure, and appreciate the partnership. You know, when you talked about mental health in the lens of comorbidity, that really resonated with me. And put it into a different sort of scope in how we think about mental health and how we think about it in our world with indolent systemic mastocytosis, and how can we partner with the medical community to understand that both need to be treated, if you will, and both need to be recognized. So a comment more so than a question, but it really did resonate with me as you described. So thank you for that.
So if I can just come back, the position paper we highlighted about implementing psychosocial care programs or making them available locally, that's not solely having access to a psychologist or a psychosocial care team over there. As we're really promoting with all clinicians, specialist nurses, surgeons, medical doctors, that they play a role in psychosocial care as well. How they give a diagnosis, if they do it in a good way, then that reduces the risks and further down the line. So we're really promoting around, we're calling it, we want them to enhance medical care to be psychologically informed. And I think that's a nice phrase to think about it, because it gives them some ownership of what we can do. And I just wanted to underline the point at the beginning. I think being connected, that sense of isolation and frustration of people not understanding, the biggest benefit for communities is for people living with a condition is being connected into a community of people who understand. And that is something which is under-recognised. And we really need to put it to the top of the agenda. By you coming together and listening and seeing people who understand, I think has such a positive effect. And I think what you're doing here, I think should be applauded, because you're creating that opportunity for people to connect and that's a protection factor.
And Matt, is there any advice or recommendation you would like to share with the community, with the mastocytosis community today?
The work we're doing with the toolkit really puts at the forefront how communities support each other and how that is fundamental and a real asset we have. So we're looking at how communities do that well. How do we make visible and accessible, trusted information about a condition, which empowers families and individuals when they're going to see a doctor, that they're asking the right questions, that it addresses any concerns, looking at peer support, whether that's individual support or within a group. So we're pulling together those good practices, and I'm here to learn from you as well. This is a two-way street. So if anyone wants to get involved in the work we're doing to shape what's needed or what some of the solutions can be, I'm really open to collaborating further.
Thank you very much, Matt. So we're going to have time for country discussions in a while. So if you have some ideas or comments, again, just feel free to write them in the chat in your local language. Don't worry about the translations. But every contribution, every experience, every initiative that you are doing at the country level, for other countries also to learn from you, from what you're doing. So feel free to share and to provide your experiences. So if you're fine, I think we can transition into the workshop part of the session. One of the, in preparation for the meeting, we sent you a pre-meeting survey just to understand from your initial perspective, what were the challenges faced from an individual perspective and also from a community perspective. And I think, give me a second. So we